Hello and welcome you all for a webinar on brief study of snake poisons. Snake poisons are one type of animal poisons. We have studied scorpion poisons and cantharide poisons so far under topic chapter animal poisons. Today we will study snake poisons. Snakes are found everywhere in the world. There are almost 2,500 species of snakes found worldwide. And in India itself, we have almost 216 species of snakes. Out of those, 52 species of snakes are poisonous. That is why we have to study poisonous snakes mainly for the purpose of study, for the purpose of toxicology. There are basically two types of snakes, poisonous snakes and non-poisonous snakes. Though non-poisonous snakes are not the part of today's study, or you can say the study of toxicology, but we have to learn the basic characteristics of non-poisonous snakes in order to differentiate them from the poisonous snake. There are a lot of snakes which are seen in this image, but we cannot say which one is poisonous, which one is not poisonous unless until we study the basic characteristics between poisonous and non-poisonous snakes. Here we have a differentiation chart between poisonous and non-poisonous snakes, what we call difference between poisonous and non-poisonous snakes. We consider some points and accordingly we differentiate poisonous snakes from non-poisonous snakes. Those points are Bailey scales, head scales, fangs, tail, habits, and the bite marks of the teeth. Okay, and if you say if you take Bailey scales into consideration, Bailey scales mean the scales which are present on the ventral surface of the snake. They are usually large in poisonous snakes, and they are small in non-poisonous snakes. Head scales are usually small in poisonous snakes and they are large in non-poisonous snakes. But there are many exceptions for that. Fangs of the poisonous snakes are always hollow, like a hypodermic needle, the needle which we use for the purpose of injection. And the fangs of the non-poisonous snakes are short and solid, and they do not have any venom to inject. That is why there is no question of having a hollowness inside it. The tail of the poisonous snakes is compressed. The tail of the non-poisonous snakes is round. The habits of the poisonous snakes is usually nocturnal. They come out in the search of food in the night, and non-poisonous snakes they can come out anytime, so they are available all day and night. Habitat is another thing and habit is other thing. Habitat means the place of residing. They are found in usually in the forests and bushy areas. And teeth marks of poisonous and snakes poisonous, they differ as far as the fangs are considered and other smaller teeth are considered. There are two fang marks with or without marks of other teeth in case of poisonous snakes, whereas two fangs marks are present with number of small teeth in case of non-poisonous snake. So you cannot say that there are no fangs in non-poisonous snake. There are fangs, but other teeth of non-poisonous snakes are equally seen along with that, because they use teeth for the purpose of holding and biting. And we have some images here for you for as far as the non-poisonous snakes are concerned. You can see different types of snakes which are so cute. All of them they are not poisonous, and we have a python here, which is a huge snake. Though it is not poisonous snake, still it is dangerous because of its size. It has got a lot of strength. It can compress. I can compress even human beings. That can swallow small human beings. A large python can swallow big human beings also very easily. Here we have the largest, biggest snake in the world, anaconda. This is also non-poisonous, but because of its strength, it can kill any animal in the world with the help of its strength. Human beings are easily killed by this animal by, compressing and by swallowing them. Here we have a rat snake, R-A-T, rat. Rat because they eat usually rats, and these are non-poisonous snakes, and these are the actual and real friends of human being because they help in cleaning all the rodents available in the mostly in the agricultural fields and in the houses. Here we are trying to classify the poisonous snakes now. Well, there are three families on the basis of poisons they secrete, and those families are ELAPIDAE, VIPERIDAE, and HYDROPHIDAE. ELAPIDAE snakes they secrete neurotoxic venom. VIPERIDAE snakes they secrete vasculotoxic venom. Vasculotoxic venom is also called as hemolytic venom or hemotoxic venom. And hydrophidae snakes, they secrete myotoxic venom. So elapidae venom acts on the nervous system, viperidae venom acts on the blood, and hydrophidae venom acts on the muscle. Those are the target organs and systems, I mean to say. Well, now we'll try to see some examples of elapidae family. The common is, of course, common cobra, which is also called as Kal, Sap, or Kal, Sarv, Nag, Naja, Naja. Naja, Naja is its zoological name. King cobra, which is also called as Naja Bangaras or Raj, Nag. Okay, and there is Indian cobra, and there are various crates. Amongst crates, we have common crate, banded crate, coral snake, tiger snake, mambas, death adder. These are all examples of elapidae snakes which are neurotoxic. Now here we see one image of uh, common cobra. You can see the hood of these snakes. This common cobra is found all throughout India, and it is also found in Burma, Sri Lanka, in the Eastern Asian countries. They have a hood on the dorsal surface of the head, you can say, just behind the head, and it looks like a spectacle. So it is also called as double spectacle mark. Sometimes there is a single mark, so it is also called as monocellate, and they have a mark hood as compared to the king cobra. Here there is a hood of king cobra, though it is a long and strong and stout snake. It can have a very huge what do you call hood, but it doesn't spread out much as compared to the common cobra. And they also may have a mark on their dorsal surface, but the typical thing is that their body has got a white stripes on it. Usually they are ashy black in color, and white stripe is their characteristics on their body. Here you can see one Indian cobra now. This Indian cobra is yellowish in color. It looks so cute, but it is highly poisonous because of its neurotoxic poison, which literally kills the human beings. Okay, and here there is one example of monocellate cobra. You can see one mark here on the hood, so it is called as monocellate. And Naja Naja Kotia is its scientific name. Now let's see the examples of various crates. Common crate, Bungarus ceruleus. This snake is neurotoxic, and here is a picture for you to see common crate. Another picture you can see common crate. As compared to banded crate, the stripes which are present on its body are smaller as compared to banded crate. Here you can see banded crate, and there are lots of yellow bands intermittently with the black bands. So banded crate and common crate, they are all commonly found in India. They are neurotoxic snakes. They are called as manyar in Marathi, and cobra is called as nag in Marathi or in Hindi. Here you can see mamba. It's a black mamba. They are found mostly in the Africa. They live mostly on the trees, and they are highly poisonous, and they have a deadly look also. Here you can see one adder in a fighting attitude. Though it looks somewhat like vipers, it is neurotoxic, so it is included in the neurotoxic family. Now we'll go to another family of poisonous snakes, that is Viperidae. Viperidae are subdivided into two groups depending upon the presence and absence of the pit. So the presence of pit means small depression near the eye, in front of the eye. It is called as pitless vipers because it doesn't have pit, and pit vipers because they have a pit. So there are two types of pitless vipers. They are Russell's viper and saw-scaled viper. And whereas pit vipers are concerned, we have common example is pit viper, Crotalidae or Crotalus also you can call. Crotalus horridus is one example. And common green pit viper. Green pit viper because the color of that viper is greenish in color. In pitless vipers, we saw that example soft-scaled viper, and here you can see the image of soft-scaled viper, which has got scales which look like this saw. So, as an instrument which is used to cut the woods, and that has appearance of carpet also. It is also called as carpet viper because carpet which we put on the floor looks like the skin of this. And this skins of vipers is utilized to make lots of artifacts, usually the belts and rich watch belts and all that. The scientific name of this snake is Echis carinatus. This snake is hematotoxic. Okay, and another example of pitless viper is Russell's viper, Daboia russelli. This is hemotoxic snake. See, it looks yellowish, quite different than soft-scale viper. Here there is one example of green pit viper because it has got a pit. You can see the pit here in the near the head, and this is a pit viper or green pit viper because of its color. Here is another example of viper, and the name of this snake is rattlesnake. Here the rattle word is R-A-T-T-L-E. So because it produces rattling sound with the help of its tail. See the tail, you see it is erect now and it is ready to produce rattling sound by vibration. And that alerts different animal saying the presence of this rattlesnake. This is highly poisonous snake. Now it is in attitude to attack somebody. This is how the attitude of the snake looks. And they usually hit slantly because they do not take up the hood. And usually the lower parts of the body are bitten by this snake as compared to the cobras. Now, Hydrophidae family has 20 types of sea snakes found in India alone. India means Indian Ocean and the different seas around India. All these species are poisonous and they are myotoxic because they uh, cause toxic effects on the muscles. Here there is one example uh, through a picture. You can see one sea snake here, highly poisonous snake, sea snake. We have to understand differences between cobra and viper mostly because these are the two common snakes found in India as well as in our vicinity. And the cases of snake bite which come to us are there either mostly cobra or viper and sometimes kraits also. And the traits of the different traits will differentiate cobra from viper, like body, tail, maxillary bone, eye, fangs, eggs, tail, and the venom. Body of cobra is long and cylindrical, and viper's body is short and stout, so it is fat, and cobra is slim. Head of the cobra is small, and head of the viper is large. Okay, large and broad, and the maxillary bone carried other teeth beside poisonous fangs in case of cobra snake, whereas there are only poison fangs, and the poison fangs of viper are mostly 1.5 up to 1.5 centimeter long. The pupil of the eye in case of cobra is round, in case of viper it is vertical. The fangs of the cobra are usually short and they are fine. uh, they are having groove and they are fixed, they don't move, whereas fangs of the viper are movable and strong and they are canalized. So the canal and groove, this is that because of for the purpose of excreting the venom. The eggs of the cobra are, there are eggs in cobra because cobra is oviparous animal. It lays eggs, whereas viper doesn't lay eggs. It gives directly birth to its babies, just like mammals, because all these cobras or viper they belong to reptile reptilia, and they all fall under Ophidia group. Tail of the cobra is round and tail of the viper is tapering, so immediately it tapers and it doesn't have a long tail. The toxic of cobra is neurotoxic mainly, and it is hemotoxic in case of viper, mainly because there are exceptions. Some cobra may have other than neurotoxic poison. That is why, because there are lots of species which we don't know. because many species are there in the world, because I told you there are around 2,500 species of snakes found in the whole world. The cobra snake lays eggs, and here you can see an image where the cobra has laid eggs, and these eggs are is a more than oval. They are elongated, like they are elongated, and they do not have a hard cover on it. They are having membranous cover. Usually, the common eggs which have fowls eggs, hens eggs, they are having hard substance, and the babies of cobra are hatching out of the eggs there. You can see through this image. And viper doesn't lay eggs, but it gives birth to babies. Babies come out in number of say 1 to 2 dozens at a time. So lots of babies are given by a viper and female. So it is dangerous to have vipers around you because their population increases very fast, and they are dangerous because they are not easily seen. They stay hiding, and when you accidentally reach that place, you may get accidental bite. And it's a horrible thing to have a viper bite because it effects last for long time, even if your life is saved. Here you can see lots of babies of viper. You can understand through this image the intensity of having viper in the area. Snake bite is giving snake venom or putting snake venom in your body. So snake bite takes place for the excretion of venom from the snake, and venomous snake usually bite for the purpose of putting venom, but non-venomous snakes also can bite without venom. So we should be able to differentiate venomous bite and non-venomous snake bite. We should understand the venom, poisonous and non-poisonous snakes, which we have seen in the first part of this program today. The snake venom is always toxic, and the toxicity of the snake differs on the species of the snake. It can be hematotoxic, it can be neurotoxic, it can be cytotoxic, it can be myotoxic. And this venom is nothing but is one form of saliva, and it is excreted through modified parotid gland. Like human beings also have got parotid gland, and they produce saliva. Saliva is a digestive juice. There are other juices in human beings. Similarly, this venom is a digestive juice of that snake. But that if that enters into other animal's body, it is dangerous to the life of that animal because it contains enzymes which are very highly toxic, and this saliva is pumped out of those the parotid glands, and they come out through a channel, uh, tubular fangs, and they enter into the body of the prey. The snake venom has a combination of various proteins and enzymes. 90% protein by dry weight, and most of these are enzymes. Almost 25 different types of enzymes are found in various venoms. 10 of these enzymes occur frequently in most of these snake venoms. And these enzymes, they cause potent effect than any of the individual effect. They come in combination. Okay. Composition of snake has to be understood for the purpose of understanding the toxicity of snake venom, because they contain various enzymes which are toxic, like phospholipidase, lecithinase, nucleotidase, collagenase, amino acid oxidase, proteinases, hyaluronidase, phospholipidase, endopeptidases, kininogenase, prothrombin activating enzyme which is present in the viper. Other than enzymes, there are some non-enzyme peptides which are present in the snake venom, like alpha bungarotoxin, beta bungarotoxin, crotoxin, crotamine, cardiotoxin, some peptides, some nucleosides, some lipids, some amines, metals such as copper, zinc, nickel, magnesium, and amongst amine there are histamine, serotonin, spermine. Just like how they are present in human beings, the same thing they are present in snake venom also. What is the mechanism of toxicity of these venoms? We'll try to understand in a brief manner. The most common type of enzymes are proteolytic, phospholipidases, and hyaluronidases. Proteolytic enzymes are meant for digestive properties. They have digestive properties. Phospholipidases are for degrading the lipids. Hyaluronate is facilitate venom spread throughout the body. Okay, it's make a way by breaking. These venoms produce different types of signs and symptoms after envenomation. Envenomation means entry of venom in the body. The signs and symptoms differ from different type of snake bite. So what will happen if a rapid snake bite takes place? It will produce some local features first, like the site of the bite. So you'll have a fang marks, two fang marks. Then there will be burning pain, and there will be swelling and discoloration of the part which is bitten by the elapid snake. Serosanguinous discharge will come out from those fangs. Local symptoms are milder in comparison to that in viperine snake. Viperine snake bite local symptoms are very severe because it is hemolytic type of venom. And in case of cobra snake bite, you can see these two fangs marks, and usually there are no much prominent local features seen here apart from some reddish discoloration. But systemic features are very grave in case of cobra bite, or you can say neurotoxic snake bite, that is elapids. Pre-paralytic stage and paralytic stage. So before paralysis and during paralysis. In pre-paralytic stage, we will have vomiting, headache, giddiness, weakness, and lethargy. In paralytic stage, there will be ptosis, means drooping of eyes, ophthalmoplegia, drowsiness, convulsion, bulbar paralysis. Bulbar paralysis means paralysis of the brainstem, and which includes medulla oblongata. So 9, 10, 11, 12 cranial nerves, they get hampered. There will be paralysis of all the muscles which are supplied by those nerves, usually which are required for the respiration. And there will be respiratory failure and death. Here you can see image of one boy suffering from ptosis and drowsiness due to cobra bite. So now he needs immediate treatment, otherwise he is going to die. VIPERIDE bite has got local features which include rapid swelling at the bite site as compared to cobra. See, there is a rapid swelling here, and there is great discoloration, bluish, blackish, and there is blister formation. Bleeding comes from the site of the bite, and there will be a severe pain also. So the local scene of a VIPERIDE bite is quite marked as compared to a rapid bite. Here is an image of viper bite. You can see their blood is oozing from the fang marks, and there is a great swelling here. That was early sign, and these are the late signs. Everything has been damaged due to hemolysis, and almost there is a necrosis or gangrene formation where you require amputation of the limbs because of viper bite. The life can be saved, but the part bitten cannot be saved. So that is why viper leaves lots of marks behind after its bite. The systemic features of viper bite includes mainly generalized bleeding. So there is bleeding for almost every orifice, and from other areas also. So epistaxis means bleeding from nose, like everywhere there is bleeding. In epistaxis, hemoptysis, hematemesis, bleeding from gums, hematuria, melena, hemorrhagic areas over the skin and mucosa. So everywhere it happens due to loss of clotting factors in the body, and it leads to hypovolemic shock due to loss of lots of blood, and the patient will enter into renal failure and eventually will die. Here is an example of gum bleeding in viper bite. You can see this image. A person is giving bleeding from mouth, and all the gums you see they are bleeding easily because the blood doesn't get clotted in case of viper bite. Hydrophid bite has got local features as well as systemic features, but the local features are a little milder. There is a small swelling and little pain, but systemic features affect the muscles in the body, and there is a pain in the muscle which is called as myalgia. Muscles get stiffened. There will be myoglobinuria and renal failure. Severe conditions will lead to the death. Here the person who is bitten by a sea snake is shown here in this image, who is lying on the bed for the purpose of treatment because he has got paralysis of the muscles. And these are the myotoxic effect of the sea snakes. Summary of manifestations related to different types of poisonous snakes can be studied through various features like cobra, crates, Russell's viper, Soskel viper, hump-nosed viper. So if you take local pain and tissue damage, it is absent in case of crates, whereas it is present in all other type, species of the snakes. If you take neurological signs including ptosis, it is not present in viper bite of sauced and hump nose, but in Russell's viper it is present, and of course it is present in neurotoxic snakes like cobras and kraits. Now hemostatic abnormalities you will not find in the a neurotoxic snakes like cobras and kraits. They are marked in the, they are present in the vipers, all three vipers. Renal complications, they are present mostly in the vipers. They are not present in the neurotoxic snakes. But in sauced also you will not find renal complications. So the species is very important to understand these manifestations. Accordingly, we can choose anti-snake venin. Anti-snake venin you can get for one species type of snake, or you can get combination also. But hump nose viper will not give response to any type of anti-snake venin. So it is most dangerous to have a bite of hump nose viper. This viper has got a hump on its nose, and other snake bite will respond to anti-snake venin. So envenomation is means envenomation means entry of venom in the body of human being or any other prey of the snake. But this envenomation depends upon uh, amount of venom which is entered into the body. If there is bite but no venom has entered, it is called as a no envenomation. And if the if the entry of the venom is more in amount, it is called as severe envenomation. If there is no envenomation, you will have no uh, local edema, erythema, ecchymosis symptom, other symptoms, but you will find only fangs marks. Fangs marks are found in every type, but in severe envenomation you will find uh, mostly what you call uh, all the symptoms, including this uh, hypotension, paresthesia, coma, pulmonary edema, and respiratory failure, and eventually death. And there are some factors which are affecting snake bite toxicity. And those factors are like body weight, aggravating factor, part which is bitten, exercise, individual sensitivity, and bite characteristic. If the body weight is more or bigger, the toxicity will be lesser. There are other predisposing factors like it is, for example, if the part bitten is usually face and trunk, it is more lethal than part bitten on the limbs. If the other factor is exercise, individual sensitivity, and bite characteristics. So snake has bitten it for the purpose of business or for the purpose of defense. Like business is for the purpose of food, defense is for the purpose of defending itself. Human beings are bitten for the purpose of defense. And plus it also depends on the bite number, depth of the bite, duration of the bite, and through clothes or without clothes, during sleep or during some activity, amount of venom which is entered into the body, condition of the fangs, age of the snake, different species, and the lethal dose. So there are different factors we have to consider to know the toxicity of the snake venom. Prognosis can be assessed as per the time of bite, activity of at the time of bite, first action taken since the bite, clinical examination, and whole blood clotting test for the purpose of assessment, whether the person is going to succumb to it or no. Laboratory investigations have to be done, like WBC count, for viper and bite, test like hemogram, renal function test, bleeding time, clotting time, platelet counts. We have to ascertain other parameters with the help of urine examiner for proteinuria, myoglobinuria. And ECG also done for the specific changes like bradycardia and AV block. EEG also is done mainly in temporal lobe for the assessment of neurological signs. And snake bite can be managed by three levels. At three levels, you can say local management and specific management and supportive management. Local management includes bitten part. So that is why for the purpose of management, we have to remember this mnemonic called as do eat right. So right means RIGST. So these letter stands they give us hint for what to do and what not to do or we have to reassure the patient, because 70% of the all snakes are mostly non-poisonous, and remaining 30% snakes are poisonous, but from them 50% bites by venomous species actually envenomation take place, means 50% do not do any envenomation due to some reasons, and this patient has to be done immobilized for the purpose of spread of venom in the body. That how we do for the fractured limb. Here you have to apply the bandage or the tourniquet, and depending upon the location of the bite. Plus, you have to take care that you are not hampering the blood supply, not applying more pressure, and because that is more dangerous than the bite. And GH means go to the hospital immediately, or call 108 and take the patient to the hospital as early as possible, because traditional remedies will not at all work. We have to take the patient to the hospital, and there you have to tell the doctor. So tell the doctor of any specific symptoms such as ptosis or vomiting or any paralysis, whatever. So that is what is called as do eat right, RIGST. So you remember these words. And first aid also has to be remembered as far as do's and don'ts are concerned, because you should know what to do and what should not be done. For example, you have to assure the patient, you have to immobilize the patient, and the application of tourniquet has to be done carefully. You have to see that you are not hampering the blood supply, and you have to call 108 immediately and take the person to the hospital immediately. Don'ts means we shouldn't go for incision and suction. That is contraindicated. Application of ice, massage, or chemical treatment should be avoided. That will further, cause danger to the life of the patient. Now, there is specific treatment for snake bite, and that is available in the injectable form, which is called as ASV, anti-snake venom. So, anti-snake venom, also called as. Now, indications for ASV is it has to be ascertained, and then it has to be given. You get a specific ASV for COBRA, specific ASV for Viper. By name also you get. Sometimes you get combination also. If there is spontaneous systemic bleeding, or low WBC count, thrombocytopenia, if there is shock, paralysis, if there is hyperkalemia, if there is local swelling is involving the whole, at least half of the bitten limb, rapid extension of swelling, here you have to give ASV. And anti-snake venom therapy is administered within 4 hours is more effective, but at least before 24 hours you have to give it, so that you will get good results. And in milder cases, you may require 5 vials. In moderate cases, you may require 5 to 10 vials. In severe cases, you require 10 to 20 vials. Then plus additional infusion also you will require, depending upon the severity of signs and symptoms. That means toxicity. Here you see one example of anti-snake venom, that is ASV. The name here you can see CroPhab, Crotalidae polyvalent. So it is mainly for the viper bite. Here we can see snake venom anti-serum, and there are different types of vials or ampoules available in the pharmacological market, pharmaceutical market. This anti-snake venom can be administered slowly by IV injection or by infusion through a drip, and depends upon the body weight of the person. You have to ascertain the dose. And yes, anti-snake venom should not be given locally at the site of snake bite through intramuscular injection or subcutaneous injection. So one should have a full idea about it, about the administration of this ASV. So because it has got lots of disadvantages also. It can cause pain at the site of injection. It can cause hematoma. It can cause increase in the intracompartmental pressure, and it may produce adverse reaction also. So ASV is known for adverse reaction in almost 20% of cases. There are some early anaphylactic reaction seen within 10 minutes to 3 hours after giving this ASV. Some late serum sickness are also seen after 1 to 12 days of giving this ASV. For example, fever, nausea, vomiting, diarrhea, arthritis, nephritis, myoglobinuria. So they have adverse reactions. A treatment of early ASV reaction can be managed with the help of adrenaline injection and antihistaminic injection and IV hydrocortisone. These are to be given with proper medical care by medical practitioners. Treatment of late and anti-snake venom reaction can be done with the help of oral antihistaminic tablets. depending upon the body weight. Patient who failed to respond within 24 hours is also given prednisolone, which is a steroid, to save the life. And supportive therapy is also given in case of severe toxicity, for example, for coagulopathy, because the coagulation is lost. In patients, in such patient, fresh plasma frozen or cryoprecipitate of different blood coagulation factors, fresh whole blood, and platelet concentrate is also given for such patients. And if the patient is more severe and having bulbar paralysis and respiratory failure, he needs intensive care. That is why he has to be taken to the ICU, because ASV alone will not save him. Yeah, we have to do tracheostomy, we have to do endotracheal intubation, and the patient has to be put on mechanical ventilation, what we call venti. And a lot of further remedies are to be given to this patient for the recovery. And the part which is bitten by the snake is taken care of with the help of other treatment, prophylactic treatment, anti-tetanus injection, as far as the allopathic treatment is concerned. But in homeopathy, after a snake bite, you cannot give homeopathic remedy immediately, because homeopathy doesn't work like antidote. We have to give antipathy first, because antidotes are required, and that is why homeopathy you can give afterwards for the systemic features, depending upon the history of the patient. So, but there are lots of remedies in the homeopathy, and which are prepared from the snakes. For example, lachesis and Crotalus horridus. You may go through Ophidia group of remedies for that. And if you have any questions, you can ask me. This is very simple, study. Lots of questions are asked in examination. Is there any question? Okay. I hope so you understood this seminar, this webinar, uh, 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 well, as far as the knowledge of snake poisons is concerned, and as far as the uh, exam point of view is concerned, because vipers and cobras are only asked in exams. With this, I end this today's topic on snake poisons. Thank you. Thanks a lot. See you soon with a new topic. Have a nice day.